Hi, it's me again. So here we're going to take a look at the muscle presentations that were submitted. Enjoy.
Okay, this is my presentation on the trapezius muscle. My name is Kisa Kaczewski, and my, again, muscle was the trapezius muscle. It is a large triangular paired muscle on the posterior aspect of the neck and thorax. The trapezius has many attachment points extending from the skull and vertebral column to the shoulder girdle. The trapezius belongs to the superficial layer of the posterior thorax or the extrinsic muscles of the back. The superior fibers start at the occipital bone and insert at the lateral third of the clavicle. This part of the trapezius is referred to as the descending part of the trapezius. The middle fibers run from the medial line of the body from the spinous processes of C1 through C6 vertebrae and supraspinous processes of vertebrae C7 through T3. They insert into the acromion of the scapula as well as the superior crest of the scapular spine. This part of the trapezius is referred to as the transverse part of the trapezius. The inferior fibers run from the spinous processes and supraspinous processes of vertebrae T4 through T12 to the lateral apex of the medial end of the scapular spine. This part of the trapezius is referred to as the ascending part of the trapezius. That is the location. So next we're going to talk about muscle action. Now, the main purpose of this muscle is to maneuver the scapula, which is shown here. And you can see how these muscles attach to the scapula here. The trapezius manipulates the scapula. It stabilizes, elevates, retracts, and rotates the scapula. The superior fibers elevate the scapula as in shrugging the shoulders or help to extend the head with the scapula fixed. The middle fibers retract the scapula and the inferior fibers depress the scapula and the shoulder. As far as the muscle nerve supply, the muscle nerve supplies the accessory nerve as well as the C3 and C4 spinal nerves. Fun facts is that it's the trapezius.
Okay, great. So thank you for that presentation. What I really liked about it was how you had the image of the scapula in red to talk about the actions of the trapezius. And one thing that I'll just reiterate, though you went through the origin and insertion in detail, is just that there is an insertion point also on the clavicle. So not only, the clavicle and the scapula are jointed together. So, the clavicle is going to come along for the ride with, for example, scapular elevation. But there are actually some fibers as well that are going to carry it along the ride for the actions of the trapezius. So great work. Thanks for kicking us off too.
What would be a quick and easy way for people to understand what tibialis anterior is? location of the tibialis anterior is right at the shin, most notably the place where you will most likely bang your leg, as demonstrated in the video. The origin of the tibialis anterior is at the lateral shaft and condyle of the tibia right beneath the knee there, while the insertion is the medial cuneiform and base of the first metatarsal at the base of the foot. The name tibialis comes from the name tibia, which is Latin for shin bone, and anterior comes from ante, meaning before, since it comes before the tibia. The tibialis anterior is the strongest of a special group of muscles known as a dorsiflexor. No, it is not a dorsal fin. In this video here, as the foot moves up, you are seeing what's occurring called dorsiflexion, which is what the tibialis anterior is doing to allow us to walk by lifting the foot upward. The tibialis anterior muscle is supplied by the deep fibular nerve. And now, here's a fun fact about the tibialis anterior. Did you know that the pain that you feel in your leg during exercise is actually caused by the tibialis swelling with blood and causing pressure, resulting in that pain? And thank you so much for watching. Here are all the links that I used in order to get information on the tibialis anterior. Hope you all enjoyed it, and I'll see you later.
Okay, Ryan, thank you very much. That was delightful. I really like how you used your skill sets in technology presentation to give us something very entertaining and enjoyable to watch. Thanks for your theatrical performance as well. So bravo, well done, and we are all better off for having witnessed your video and having you as a part of this class. So thank you for that participation. We really appreciate it. Morale is up.
Hi, my name is Kathleen, and I'll be presenting on the pectoralis minor. Pectoralis minor originates here, where you can see it is where it is at the ribs of 3, 4, and 5. You can also see that it's originating in the anterior surface of the ribs. The 3rd, 4th, and 5th rib, you can see that it is relatively near the costal cartilage, which is the white portion you see on the ribs near the sternum. And that is where it originates. So the anterior surface of ribs 3, 4, and 5, then it also extends up and inserts on the coracoid process of the scapula, but not the entire part. It is on the medial surface of the process, so it originates on the ribs and inserts on the medial portion of the medial aspect of the coracoid process of the scapula. The pectoralis minor is smaller than the pectoralis major, so it won't have a great of an effect, but is still very important to serve an important role. For one, it stabilizes the scapula, so the muscle being there when the muscle is toned and doing what it does will help in stabilizing the scapula because it attaches there and attaches on the ribs. When the muscle contracts and when it is contracting, it's pulling against the coracoid process, but it's pulling down just based on how the structure of that muscle is. It's pulling inferiorly and anteriorly, so it brings it down and forward. That is the origin, insertion, and action of the pectoralis minor. The nerve supply of the pectoralis minor comes from the medial pectoral nerves C8 and T1, which is one of the minor branches of the brachial plexus that arises from the cervical portion of the spinal cord. So an overview of the pectoralis minor, the origin is in the anterior surface of ribs 3, 4, and 5. The insertion would be the medial aspect of the medial surface of the coracoid process of the scapula. For the action, it helps stabilizes the scapula and it pulls inferiorly and anteriorly against the thoracic wall, as you see in the picture of this muscle. The name pectoralis minor originates with the first word pectoralis, which comes from the Latin word pectus, meaning breast. Minor comes from Greek and it means the lesser. The name came to be because the pectoralis minor is a triangular shaped muscle located at the chest of our body, and it makes up a lot of our chest muscles and is right underneath the breast. The name minor is also because this muscle is the smaller of the two pectoralis muscles. Some facts about the pectoralis minor is that when the pectoralis minor is injured, it is hard for the doctor to locate the injury because it is often mistaken for the pectoralis major injury. The two injuries also coexist since the treatment approach to the two injuries differ the correct diagnosis of an isolated pectoralis minor tear. It is important and may require imaging to confirm. The patients with complete pectoralis major tears usually undergo surgery, and the rehab phase for the pectoralis minor injury tears can last up to 12 weeks. Conservative treatment approaches usually heal the muscle, and most athletes can return to their sport with no long-term detriments to their performance.
Okay, great work. So what I really like what you did there is excellent use of technology. I love how slowly and clearly you spoke. That was excellent work. And what an interesting fact, clinical fact about the pec minor tear. You did mention that there's imaging used to diagnose that, which is great. As a physical therapist, we're trained to be able to diagnose that without medical imaging. So we do run diagnostic testing that can help isolate those differences, right? And how do we know they have different functions, the pec minor to the pec major, just as you said. So the treatment is different depending on what that is. Okay, great. Really enjoyed the presentation. Thank you for sharing.